delight to be here and talk about some of the work that we're doing with Health Up SOS and Health Up for Good. And we're here to help everybody live healthier, happier, longer lives. We started the company in Palo Alto about 7.5 years ago with a mission to help everybody live healthier, happier, longer lives. And I'll tell you the story of how we're doing it. So I'm getting a call a couple of years ago, very late, from one of our customers. So now, we've served hundreds of millions of people in 174 countries all over the world on the consumer side of the equation, but we also have some enterprise customers right now on the insurance company side, on the provider side, and large self-insured employers. One of them is the Fortune 500 company Flex, Flextronics, if you remember it from the past. And their CHRO gives me a call in a very odd hour saying, Ron, I need your help. And I'm like, of course, I'm happy to help. What can I do? And he said, something really bad happened in India, and we have a big plan there and a lot of people, and we want to help them. We were very committed to their health and well-being, not just their work. And there's a huge flooding in Chennai, India. And the flooding is affecting everybody in that city. And it's pretty devastating. People are losing their homes. A lot of people lost their lives. A lot of injuries. And we were trying to help our employees there. And can we do something in Chennai, India? And I remember that the only thing that I had in mind is like, I don't know exactly how we're going to do it, but we're going to bring the entire team from wherever they are and just figure out how to get to these people and give them help as quickly as possible. And literally within a couple of hours, the entire team was back in the office, and all of us together worked tirelessly to actually put doctors in front of these people that needed them in India from their mobile device. It doesn't matter if they had a feature phone or a sporadic web access. The ability to put in front of them immediately help really changed the situation for thousands of them. Health Up SOS was born that night, and we didn't know that we're creating a new product, but we just wanted to help, and we're able to bring more than 5,000 physicians. We'll talk a little bit about our physicians in a minute, but 5,000 physicians were deployed in literally a couple of hours to help people in that flooding. And then we realized that it's not just the physicians and the consultation that they can give in real time, but actually the idea of providing their vital information to people when they need it most just right from their phone is life-saving. So we actually package for them all kind of checklists. So the doctors work together not only to be available to the people in the flooding area, but also to package for them checklists of the things that they should and shouldn't do around the flooding. And that was amazing because we realized that a lot of what's happening in a disaster time is that people panic. And a lot of the injuries are happening not necessarily because of the disaster itself, but it happens because people panic. So the ability to package the doctor knowledge and provide it to the people in the form of a checklist was literally a life-saving option. And we were able to change the course of lives of thousands of people for the better literally within a couple of hours, and created a product that eventually became available in minutes to people that are using it all over the world. What I'd like most about this is to hear the stories of these people, and the reason for everything that we're doing on Health Up is compassion. We want to help people. We want to help them live healthier, happier, longer lives. And hearing the stories of these people, individuals, and you think, wow, you're in an area like that, your wife is pregnant, and she's pregnant with twins, and all of a sudden there's this crazy flooding, and you can't get to a hospital, and something happens, and what do? And the stress and the emotion that is associated with it, and be able to put in front of this person and his wife a doctor, a reassuring doctor that was able to give them the right kind of advice, that walked them through the next few hours until they were able to get to a hospital, was literally life-saving. And that was Health Up SOS, and we did it with thousands and thousands of people. That was the first time that we did it was in the flooding, but then we decided to expand it to other critical situations and natural disaster and not so natural disasters, all the way from hurricanes to floodings to even man-made disasters like terror attacks and other ways, under unfortunate circumstances where people get into a point where they need help, but it's difficult for them to get help very quickly. We did it because we believe that healthcare is a fundamental human right. I started the company with this conviction, and everything that we're doing in the past few years is exactly for this reason. It all starts with doctors, with compassionate doctors. Yes, we're a technology company. We build some of the most sophisticated technology in the world in the heart of Silicon Valley with one of the best engineers and technologists in the world. But actually, technology is just one part of what we're doing, because compassion is the heart of our technology. And it all starts with compassionate doctors that want to help people. HealthTap has more than 108,000 doctors in its network to date in 174 specialties across all 50 states in the United States. Only doctors in the US for now, but expanding now to doctors in other countries as well. But this doctor network is just one by one amazing individuals that are all there to help people live healthier, happier, longer lives. But in order for us to be efficient and provide value to people beyond one-on-one consultations, which we're doing, and we'll talk about it in a second, what we have done in the past more than 7 years is codify the knowledge of these doctors to actually a system or a database, or what we call the knowledge base, that enable us to understand how doctors think and codify the knowledge in a way that is useful later for many other people. We have served more than 6 billion doctor answers to people all over the world, building this huge knowledge base of medicine. And now we have the ability to package this knowledge in a way that enables to deploy only the knowledge of physicians, even when physicians are not available. Artificial intelligence is very powerful, but artificial intelligence is not just the algorithms and the computer science that is built behind it, but it's most importantly the knowledge base or the training set that actually trains the AI. And this training set is unique and second to none. And we're very, very excited to be able to bring not only the doctors and their compassion and knowledge to individuals one by one, but to actually use artificial intelligence to package it and make it available. And I'll show you how it works in disaster areas and enable us to be more extensible, more scalable than we've ever been before. This is a little bit technical, but this is the diagram of the health operating system that we've built in the past few years to actually provide access to care to people everywhere. We have apps on iPhone, Android, iPad, Android tablet, wearables. We're the first app on the Apple Watch, first app on Amazon Alexa. So we do all kind of fun stuff with technology. But to enable that, we have behind the scenes this amazing piece of technology that is the first ever interoperable platform in healthcare. It's called HOPES. It's the first health operating system that connects the entire continuum of care to one personal health record. HOPES enables us to connect not only the administrative parts like scheduling and payment to your personal health record, but also the library, which is where you learn about health and well-being, telemedicine, which is where we connect doctors and patients 24/7 from any mobile device or personal computer, services to make sure that you can get prescriptions or can connect with a lab to get a test done or interpreted, directory to understand which doctors you're connecting to and to be able to actually match you with the right doctor, and last but not least, a full clinical CRM to engage patients between and after doctor visits, and a very robust data and analytics layer that enable us to use this data to actually personalize information and services to people as we go. The health operating system is also connected to the cloud through the HealthTap Cloud, to other services like electronic medical records, claim data, devices, apps, and more. If you want to talk with me more about it, I'm going to be here after the talk. I'm happy to spend as many hours as you want because this is what we do for fun. On top of this amazing technology, we are actually able to deliver this knowledge of doctors packaged in a way that is extremely valuable to people in a very succinct way. This is for example, on an Android device. It can be on a feature phone. You don't even need to have a smartphone to get access to HealthTap. You can do it from any mobile device or personal computer, and basically enables us to package this knowledge and deliver it in disaster areas or in any other area of people in need. This is an example that we did in one of the recent hurricanes that unfortunately this year were more than the previous years. And just like Jill said, make basically our services, our doctors, but also their knowledge available to people who need it most, whether it's showing them answers that were given to people like them in similar situations or checklists that are very valuable for them to manage health and well-being. And that enable us to do this at scale and make it available anywhere in the world 24/7. We did that in Chennai, as I said. We did it in many other places since then, like in Haiti, in Texas, in Florida, and even in California during the fires. What we do is make our doctors available, and every time that we call our doctors, more than 108,000 of them in our network, we get thousands of doctors that immediately volunteer to actually be available in real time using our telemedicine platform on the health operating system to people when they need it most. And that's amazing. You think about Doctor Without Borders, but like, what borders even talking about? I mean, this is available, this is in the cloud. This is available anywhere, anytime, from anybody, but not only the technology, but the doctors themselves that are there to personalize the response that they have to the situation that happens on the ground. They get from us update about what's going on in real time, so they can actually tailor these interventions to what's happening on the ground. And imagine what can happen in a situation like infectious disease, for example, right? When you really don't want to deploy your doctor into the disaster area because you're going to end up without doctors. So what happens when we can actually deploy the doctors remotely without the need to put them in danger, right? But still provide the knowledge and the information that people need in real time, and do it with thousands and thousands of doctors. And it doesn't matter how many doctors you employ, your ability to do that is impossible because you need to have both the technology, the infrastructure, but also the engagement of the doctors, our ability to serve more than 6 billion doctor answers by doctors without really having any payment involved in these answers. It is our ability to wake up in like minutes, thousands of doctors, and make them available to people when they need them most. So all this great work that the doctors have done, my engineering team has done, my product design, has inspired us to do more. As we're growing as a company, as we're growing the business as well, as I said before, we're working with hospital systems, providers, government, insurance companies, to provide them our platform as a service. We decided to go even deeper into what we're doing and provide more services to people who cannot afford it. Last week, at the beginning of the year, we announced HealthTap for Good. And if you, by any chance, know somebody who doesn't have access to care and are in financial need, you don't need a hurricane or a fire to be eligible to get from us free access to care, but you can apply. And we actually decided to devote resources to provide people free consultations to doctors, to provide doctors that are serving underserved populations in need free licenses to our software, and even to nonprofits that are doing good at scale. And we believe that they can use our help to get licenses that are worth millions of dollars that we provide to large providers and government to enable them to provide these services to people that are in need. So if you want, you can go to healthtap.org, and you can find more information about it. These are free services. All you need to do is apply. We already have many individuals who applied and received the services. We have organizations both in the United States and outside of the United States who are working with us on this. And if you know other people who are in need, we'd be delighted to provide help, not only in disaster times. So what have we accomplished to date? We've served hundreds of millions of people all over the world. We serve more than 6.7 billion doctor answers to date, and we received more than 25,000 notes from people saying, "Thank you for saving my life." That's the notes that people actually took the time to send us. So, and this is just the beginning. I mean, the beautiful thing about it is that we're learning, we're growing, and we're building. It took about 7.5 years to build this slide that I'm so excited about, but we want to make sure that we're accelerating the rate in which we're helping people going forward. So imagine what we'll be able to accomplish tomorrow when actually a health operating system is deployed all over the world. We're going to hear announcements this year of HealthTap expanding into 6 different countries around the world, in enabling these amazing services, from information about health and well-being to connecting with doctors 24/7 from any mobile device or personal computer, get prescriptions, get tests done and interpreted, and engaging people around their health and well-being everywhere around the world. And what's possible to do when we start expanding into different, not only different geographies, but also into different languages. A few months ago, we announced that HealthTap was actually launched in Chinese. So HealthTap is available right now in Mandarin and Cantonese. We announced HealthTap Espanol, which is available in Spanish as well. And that puts us in front of another 2 billion people around the world that have very limited access to health information and the best doctors and the infrastructure that is required to deliver care. So we're very excited about that, and we're very inspired to continue doing work. If you know people that need our help, whether they can afford it or cannot afford it, we can help serve all of them. And we are here to help billions live healthier, happier, longer lives. Thank you very much.